Hi, my name is Dr. Matthew Talley. I'm a clinician here at Cerebrum Health Centers. You know, I was in my neighborhood just the other day and I ran into a young man, a teenager, and I asked him, I said, "Hey man, do you play any sports?" And he said, "Yeah, I used to, but I don't anymore." I'm like, "Well, why don't you play sports anymore?" And he said, "Well, a year ago, I had a concussion and I just I can't play sports anymore." I said, "Well, did you not recover from your concussion?" And he said, "That's just it." He goes, he said, I rested and did what my neurologist said to do. And then I went back in for, another MRI. And he said, my neurologist looked at the MRI and said, well, everything looks perfectly normal. So I think we don't have anything else that we can do here. He said, but I still have all these symptoms. But my neurologist keep telling me that, hey, your MRI looks completely normal. There's just, all you can do at this point is rest for the next 6 to 12 months because we don't see anything really wrong here. And I said, well, here, I'm curious. Can you tell me about the accident you had when you were playing? And he goes, better yet, he said, I can actually show you video of it. So he pulls out his camera and he shows me some video of the accident. And I looked at how his head was hit. And I go, well, here, let me tell you a little bit something about how all this works, your brain. And it's looking at this impact. So I said, the very top up here, the top of your brain is called your cortex. And that's that whole area back here behind your forehead, all through here. And then right underneath your cortex is your brainstem. And that's right back here. And it turns out the two of these have very different densities. Your cortex has got the density kind of like soft butter or jello even. It's not quite as thick. However, right underneath it, the brainstem has the density more of celery. It's a lot thicker. And so when you've got these two different densities right here, when you fall down and you hit your head hard like you did in your video, a shearing effect will happen right here. So then I go, well, what structures lie in this area that could be damaged that wouldn't show up on an MRI? Well, let's talk about it. Well, first off, I asked him, I said, are you having difficulty reading? Do you find yourself actually maybe even getting a headache while you read? He said, yes, absolutely. He said, I'm trying to do my homework, I read. And he goes, and I find myself having to read things 2, even 3 times over. He said, and then he said, after I've been trying to do my homework for even just a little while, I start getting a headache. I'm like, well, that makes sense to us. I said, right at this part of your brain is actually a lot of systems that control your eye movements, your eye muscles. And so if those begin to become actually dysregulated, you're gonna have difficulty moving your eyes together. And then that's gonna give you difficulty reading. It's gonna become very exhausting and hard to process. I said, let me ask you something else. I'm saying with these headaches, are you finding that they're actually maybe a little bit sensitive to light? Do bright flashes of light begin to bother you, or even bright lights in general? He said, yes, they absolutely do. I said, well, that makes sense to us. Right here in that same area, there's something called your superior colliculus. Your superior colliculus processes a lot of light that then comes into your brain. That could have been dysregulated. I said, how about sound? Do loud noises begin to bother you? He said, yes, they do. He said, in fact, there's been a couple of occasions where a loud noise actually causes what my parents think might even be a panic attack. Like, well, that makes sense to us. Right underneath the superior colliculus is the inferior colliculus. The inferior colliculus processes a lot of audio stimulation. And so that could have become dysregulated. I asked him, I said, I'm curious, something else. Do you find yourself actually more anxious than you used to be, or maybe even getting more angry? He said, no kidding. He said, my parents basically say I fly off the handle all the time. He goes, I get mad at the slightest little things. And he said, I feel like I'm nervous all the time, almost jittery. I said, well, that makes sense to us too. I said, right here, when this shearing effect happens, that is the top of my brainstem is called my mesencephalon, or my midbrain. And right there is a lot of regulation for your sympathetic nervous system, your fight or flight response. If that becomes dysregulated, you're gonna have difficulty controlling anxiety and fear, and especially frustration and anger. I said, I'm asking something else. Right there in that region, I'm curious how your motivation levels are. Do you find yourself less motivated? He goes, you know what? He said, I have been a lot less motivated to the point where my grades are even plummeting. And he goes, my teachers think it's because I can't play my sports anymore. He goes, but it's not the case at all. I said, I find it's with everything. And my parents, they know me. And my parents realize I'm not quite the same. It's not just that. And I said, well, that makes sense to us too. Right there in that part of your brain, that's your substantia nigra. It produces dopamine. And dopamine is necessary for you to have a healthy motivation response when you want to have one naturally. So it really kind of floored him. He said, he said, you've just literally broken down every symptom I've had, and all you did was just look at that video and talk to me about how my brain works. And I said, that's exactly what we do here at Cerebrum. So if your MRI is showing completely normal, and you're not getting any real answers as to why you have all these symptoms, and they're telling you they're just in your head, I've got news for you. They're not just in your head. And I want you to come and see us. We'd like to be able to do an exam on you of your neuromusculoskeletal system. We have a lot of different gold standard diagnostics we're going to run on you, and I want to give you 3 things. So the first thing I want to give every one of my patients, first off, is answers, explanations, and understanding as to why they're still struggling with things, be able to connect some dots for them neurologically. Second thing I want to be able to give them is some healing. We have some incredible rehabilitation here where we stimulate and rehab the entire neuromusculoskeletal system, and it really produces some amazing results in the vast majority of our patients. And that produces then the third thing, which I want you to have again, and that's hope. Right now, you've been resting for the whole past year, and you're still right where you started. There's no answers. The neurologists are baffled, but we're not. So make an appointment, come and see me, and let us help.